You've just eaten, and now you're waiting for that heavy, foggy feeling to hit, the eyelids getting a little too heavy, the brain slowing down mid-sentence, that strange restlessness that makes you want to lie down at your desk 20 minutes after lunch. That's your blood sugar spiking and crashing, and if you felt it, you already know it's not just uncomfortable, it's disruptive. It steals your afternoon, it makes you reach for more sugar to fix the very problem sugar caused, and over months and years, repeated spikes like that are part of how prediabetes quietly becomes diabetes without anyone noticing until a lab test says so. I'm a physician, and I want to walk you through exactly which foods interrupt that cycle, not with vague wellness advice, but with the actual biology of what's happening inside your gut and your bloodstream when you eat the right thing at the right moment. Because here's what most people don't realize. You don't need to overhaul your entire diet to see a difference. You need to change a handful of specific choices, and the effect can show up within the very same meal. Because here's what most people don't realize. You don't need to overhaul your entire diet to see a difference. You need to change a handful of specific choices, and the effect can show up within the very same meal. Because here's what most people don't realize. You don't need to overhaul your entire diet to see a difference. You need to change a handful of specific choices, and the effect can show up within the very same meal.
Let's start with apple cider vinegar, because it's the one that surprises people the most. It sounds almost too simple, the kind of thing you'd find in a home remedy book next to advice about garlic and honey. But there is real, measurable physiology behind it. Vinegar contains acetic acid, and acetic acid does something quite specific inside your digestive tract. It partially inhibits an enzyme called alpha amylase. That enzyme's entire job is to break down the starches you eat into simple glucose molecules quickly, so they can be absorbed into your bloodstream. When you slow that enzyme down, even modestly, the starch from your meal gets broken apart more gradually, which means the glucose that eventually reaches your blood arrives in a slower, steadier stream instead of a sudden flood. No flood, no spike, no crash 2 hours later. Research on this has been fairly consistent for over 2 decades now. A tablespoon or 2 of vinegar, diluted in a glass of water, taken shortly before a carbohydrate, heavy meal, measurably blunts the rise in blood sugar that follows that meal. I want to be clear about the diluted part, because I've had patients try to drink it straight, thinking more concentrated means more effective. It doesn't work that way, and straight vinegar will irritate your throat and slowly erode the enamel on your teeth over time. Diluted, before the meal consistently, that's the actual protocol, and it costs you almost nothing to try tonight. Next, cinnamon. But I need to stop you before you reach for the shaker in your cabinet, because there's a detail here that almost nobody knows. There are 2 completely different types of cinnamon sold commercially. Most grocery store cinnamon, the cheap kind in the red and white tin, is called cassia cinnamon. There's another type called Ceylon cinnamon, sometimes labeled true cinnamon, and the difference matters more than you'd think. Cassia cinnamon contains a compound called coumarin, and in larger amounts, coumarin can put real stress on your liver, especially if you're consuming it daily over a long period. Ceylon cinnamon contains only trace amounts of coumarin by comparison, which makes it the safer choice for regular use. Now, why does cinnamon matter for blood sugar in the first place? The compounds in cinnamon appear to increase the sensitivity of your cells to insulin. Think of insulin as a key, and the receptors on your cells as locks. Insulin's job is to unlock the cell door, so glucose can move out of your bloodstream and into the cell, where it can actually be used for energy. When your cells become resistant, that key starts to fit poorly, glucose backs up in your blood, and your body has to produce more and more insulin, just to force the same result. Cinnamon seems to help that key turn more smoothly again. Roughly half a teaspoon a day of Ceylon cinnamon is a reasonable and safe amount for most people, and the easiest way to use it is to just stir it into something you're already drinking or eating. Your morning coffee, a bowl of oatmeal, a spoon of yogurt. You're not adding a new habit, you're modifying one you already have. The third piece is the one I find most underrated of everything I teach patients, and it costs absolutely nothing. It's simply the order in which you eat your food. Most of us were never taught this, so we eat however the plate happens to be arranged, or however our culture typically serves a meal, without thinking about sequence at all. But there's real research on what's called the eating order effect. If you eat your leafy greens and fibrous vegetables first, your protein second, and your carbohydrates and starches last, something interesting happens physically inside your stomach and intestines. That fiber, eaten first, forms a kind of loose mesh as it moves through your digestive tract. When the carbohydrate arrives afterward, it has to pass through and around that fiber mesh, which physically slows how quickly it can be broken down and absorbed. The result is a flatter, gentler blood sugar curve after the meal, measurably flatter in studies comparing the exact same meal eaten in different orders, same ingredients, same total calories, different sequence, different outcome in your bloodstream. I tell patients this constantly because it requires no new shopping list, no new recipe, no financial cost at all. It's simply a matter of picking up your fork and choosing to start with the salad instead of the rice. None of what I've covered so far replaces medication if you're currently taking it, and none of it replaces an honest conversation with your own doctor about your own numbers, your own history, and your own risk factors. What this is a real, evidence-based toolkit. 3 tools you can put to use at your very next meal, starting tonight, with things that are likely already sitting in your kitchen. In part 2, I want to move into fat and protein, specifically the fish, the beans, and the small handful of nuts that can quietly change how your body handles the carbohydrates you're already eating, and why the amount of fat on your plate matters far more than most people have ever been told. Welcome back. In part 1, I gave you 3 tools you can use immediately: diluted vinegar before meals, Ceylon cinnamon worked into your day, and eating your vegetables before your carbohydrates. Today I want to talk about fat and protein, because I think this is the area where patients have been given the worst advice for the longest time. For years the message was simple and, frankly, wrong. Fat is bad, cut the fat, and you'll be healthier. What that advice actually did, in a lot of cases, was push people toward low-fat products that replaced fat with refined starch and sugar to keep the taste acceptable. And that swap made blood sugar control worse, not better. So let's correct the record, starting with fish. Fatty fish, salmon, mackerel, sardines, and to a lesser extent trout, are rich in omega-3 fatty acids, and omega-3s do something that most people never connect to blood sugar at all. They fight chronic, low-grade inflammation. This matters more than it sounds like it should, because inflammation is one of the quiet, underlying drivers of insulin resistance. Go back to that lock and key picture I described earlier. Insulin is the key. Your cell receptors are the lock. When your body is in a state of ongoing low-grade inflammation, which can come from stress, poor sleep, excess body fat, or a diet heavy in processed food, that inflammation essentially rusts the lock. The key doesn't turn as smoothly anymore. Insulin has to work harder. Your pancreas has to produce more of it, and over years that extra strain is part of how type 2 diabetes develops in the first place. Omega-3 fatty acids help address that rust at a cellular level. This isn't a same-day fix the way vinegar is. You won't eat salmon tonight and see a different number on a glucose meter tomorrow morning. This is a slower intervention, something you build over weeks and months of consistent eating. 2 to 3 servings of fatty fish a week is a reasonable target for most adults. And if fish isn't accessible to you, a good quality fish oil supplement is a second best option, though whole food is always my first choice when it's available. Now let's talk about legumes, because I think beans are one of the most underrated foods in modern nutrition, full stop. Lentils, chickpeas, black beans, kidney beans. These foods do something almost no other carbohydrate source does as well. They combine meaningful fiber, meaningful protein, and something called resistant starch, all in the same bite. Resistant starch is exactly what it sounds like. It resists digestion in your small intestine, which means it doesn't get broken down into glucose the way most starches do. Instead, it travels further down into your colon, where the bacteria that live there ferment it. That fermentation process produces compounds called short-chain fatty acids, and those compounds have been shown to improve how sensitive your cells are to insulin, essentially working from the inside of your gut outward. So when a patient tells me they're trying to cut carbs entirely and asks whether beans count as one of the carbs they should avoid, my answer is always the same. Beans are not the carbohydrate you need to worry about. They behave nothing like white rice or white bread in your bloodstream, despite technically belonging to the same macronutrient category. If you're looking for one single food swap that does the most work with the least effort, replacing a refined starch with a legume, even a few times a week, is one of the best moves available to you. Nuts deserve their own mention here too, specifically almonds and walnuts, a small handful. We're talking a quarter cup, not a full bag. eaten alongside a carbohydrate containing meal adds fat and protein to that meal, and both of those macronutrients slow down how quickly your stomach empties its contents into your small intestine. Slower gastric emptying means a slower, gentler release of glucose into your bloodstream afterward. I often tell patients this directly: if you're going to have a slice of bread or a serving of rice, don't eat it alone. Eat a few almonds with it. You are not eliminating the carbohydrate, and you don't need to feel like you're constantly restricting yourself. You're simply changing the speed at which that carbohydrate reaches your blood. And speed, more than almost anything else, is the difference between a mild, manageable rise in blood sugar and a spike that leaves you foggy, irritable, and reaching for something sweet 2 hours later to compensate for the crash that follows. Last for today, and this one is almost embarrassingly simple, but I bring it up because I see it overlooked constantly: plain water. Even mild dehydration measurably raises the concentration of glucose in your blood, simply because there's less fluid volume for that glucose to be diluted into. If you check your blood sugar, and the number looks higher than you expected, one of the fastest, simplest things you can do is drink a full glass of water and take a 10 to 15 minute walk. Movement matters here too, because contracting muscle can pull glucose out of your bloodstream and into muscle tissue without needing extra insulin to make that happen at all. It's one of the only ways your body can lower blood sugar independent of the insulin pathway entirely. It won't replace the deeper dietary changes we're discussing across this series, but as an immediate, in-the-moment tool, it's one of the most accessible things available to you, and it costs nothing. Put together, fish for the slow, structural work of reducing inflammation, legumes as one of the smartest carbohydrate swaps you can make, a small handful of nuts to slow down whatever carbohydrate you do eat, and water and movement as your immediate reset button when your numbers feel off. In part 3, I want to take you into the ingredients sitting in most people's spice cabinets right now that almost nobody connects to blood sugar, and the one fruit that behaves completely differently from the rest of the fruit bowl. Welcome back for the final part of this series. Today I want to cover the ingredients almost nobody talks about, correct the biggest mistake I see in patients who think they're already eating well, and then tie everything we've covered across these 3 parts into one simple, repeatable rhythm you can actually live with. Let's start with fenugreek seeds, because this is the one that surprises people the most. It's an ingredient that's been sitting quietly in spice cabinets for generations, mostly used in Indian and Middle Eastern cooking, and almost nobody connects it to blood sugar at all. Fenugreek seeds are unusually rich in a soluble fiber called galactomannan. When you soak the seeds overnight in water, that fiber swells and turns into a gel-like substance, and when you consume that gel, it coats and slows down the digestion of whatever carbohydrate you eat alongside it. There's real clinical research behind this. Studies using a modest daily dose, around 10 grams of soaked seeds, have shown a measurable reduction in fasting blood sugar over a period of just a few weeks of consistent use. The taste is slightly bitter with a faint maple-like note, which is honestly not unpleasant once you're used to it. The easiest way to use them is to soak a spoonful overnight, then stir the softened seeds into yogurt in the morning, or grind them into a fine powder and mix that into warm water. It's a small, inexpensive addition, and it's one of the few foods on this entire list that most people have genuinely never heard of in this context. Next, let's talk about fruit, because fruit is healthy is one of those blanket statements that sounds true, but hides an enormous amount of variation underneath it. Berries, blueberries, raspberries, blackberries, and strawberries are lower in sugar than most other fruits, and they're unusually high in fiber relative to their sugar content. They're also rich in pigment compounds called anthocyanins, which are responsible for their deep color. And research suggests these compounds actually improve how efficiently your cells take up glucose from your bloodstream. Compare that to something like a glass of fruit juice, even one labeled 100% juice. The fiber has been completely stripped out in processing, and what you're left with is concentrated sugar that hits your bloodstream almost as fast as soda does. Same fruit, in a sense, but a completely different metabolic outcome depending on the form it's in. If you want something sweet, and you're thinking about your blood sugar, a small bowl of mixed berries is going to treat you far better than almost any other fruit option on the table. Unsweetened Greek yogurt is worth mentioning here too, mostly because of what it does for your gut. It's high in protein on its own, which is useful, but it also contains live bacterial cultures that support a healthy gut microbiome, and we now understand that certain strains of gut bacteria directly produce compounds that improve insulin sensitivity as part of normal digestion. The word, unsweetened, is doing a lot of work in that sentence though, and I want to be direct about it. Flavored yogurts, even the ones marketed as healthy, frequently contain more sugar per serving than a candy bar does. Read the label every single time, not just the front of the container, but the actual grams of sugar listed in the nutrition panel. And while we're on the subject of simple daily habits, plain black or green tea deserves a mention as well. Tea contains compounds called polyphenols that appear to slow carbohydrate digestion somewhat and improve how efficiently your muscles take up glucose from the blood. A cup with a meal, unsweetened, costs you nothing, takes no extra effort, and adds one more small advantage on top of everything else we've discussed. Now the mistake, the one I promised you, and honestly the one I see most often, even in patients who are trying hard and genuinely believe they've cleaned up their diet. People swap sugar for refined carbohydrates and assume the problem is solved. White rice instead of soda. White bread instead of pastries. Low-fat crackers instead of chips. On the surface it looks like real progress, and I understand why it feels that way. But metabolically, your body often treats a bowl of white rice, or a couple of slices of white bread, almost identically to a spoonful of sugar, because the refining process strips away the fiber and bran that would normally slow digestion down. Once that natural break is removed, the starch breaks down into glucose nearly as fast as sugar does. This is exactly why two people can eat what looks like the same calories and end up with completely different blood sugar responses. It isn't only about what you eat, it's about the form the food is in, the order you eat it, and what you pair it with. So let's bring the entire series together into one simple rhythm you can actually carry into a normal day, because none of this is useful if it stays scattered across 3 separate lists. Before a carbohydrate-heavy meal, a tablespoon or 2 of vinegar diluted in water, vegetables and protein first on your plate, starches last. A little Ceylon cinnamon worked into your coffee, oatmeal, or yogurt, most days of the week. 2 to 3 servings of fatty fish weekly, and legumes swapped in for refined grains, whenever it's reasonable to do so. A small handful of almonds or walnuts alongside any carb-heavy meal. Berries instead of juice when you want something sweet, unsweetened yogurt or a cup of tea somewhere in your day, and fenugreek if you're willing to try something new. Water and a short walk whenever your numbers feel off in the moment. None of this requires perfection, and I never want a patient to hear this kind of information and feel like they have to execute all of it flawlessly starting tomorrow morning. Blood sugar control is built meal by meal, choice by choice, and every single one of these small swaps moves the needle in your favor rather than against it. If you're currently managing diabetes or prediabetes, please treat everything across this series as a complement to your care, not a replacement for it. And talk to your own physician before making any significant changes, especially if you're on medication, because some of these habits can shift your numbers enough to require a dosage adjustment. Pick one thing from today, start there, and build from it. That's genuinely how lasting